Hello everyone. Today I want to talk about Alzheimer's blood tests, a fascinating development in medicine that occurred in the fall of 2020. This, of course, separate from all the advances that occurred revolving around COVID-19. A lab in St. Louis, Missouri, C2N Diagnostics, created an Alzheimer's blood test named PrecivityAD. PrecivityAD uses mass spectrometry to detect specific types of beta amyloid. Let's first talk about what Alzheimer's is. Alzheimer's is the most common progressive neurodegenerative disorder that results in brain atrophy and loss of brain cells. It is also one of the most common causes of dementia, with 60 to 70% of dementia patients having Alzheimer's. Alzheimer's disease results in persistent memory loss, which could result in getting lost in familiar places or forgetting the names of family members and other critical objects. Other than memory loss, Alzheimer's causes difficulty concentrating or thinking. This will, of course, severely impair the individual's ability to multitask. Furthermore, Alzheimer's impairs people from making reasonable decisions and judgments in everyday situations. Although there are medications that may temporarily improve or slow the progression of these symptoms, there is unfortunately no treatment to alter the disease process. For these reasons, it is dangerous for a patient to be left alone. Therefore, it has become essential for Alzheimer's to be detected before the symptoms worsen and possibly place the individuals in further danger. The current diagnostic tools are brain imaging and spinal fluids. However, these tests are invasive and expensive, which limits people who can be diagnosed to Alzheimer's, even though there's millions of people suffering. The Alzheimer's blood test serves to present a more accessible and efficient method to detect Alzheimer's disease. In the fall of 2020, PrecivityAD was developed by C2N Diagnostics, and it became available to most of the US for a routine lab test. As mentioned earlier, this test uses mass spectrometry as an analytic technique used to measure the mass-to-charge ratio of one or more molecules to detect specific types of beta amyloid. Most notably, PrecivityAD detects a polyprotein A that is known to influence Alzheimer's disease risk. For more clarity, beta amyloid is a protein that is the primary component of plaques and brain lesions, both of which are characteristic of Alzheimer's. Beta amyloid is formed from the breakdown of a larger protein, known as the amyloid precursor protein. The beta amyloid then clumps together, resulting in plaque that collects between neurons. As plaque builds up in the brain levels of beta amyloid decrease in the surrounding fluid. This concept was previously used in spinal fluid tests. Back to PrecivityAD, which is predicted to be the beginning of a new generation that could allow for early detection of Alzheimer's, possibly several decades before the onset of the first symptoms. This is important as it also can be used for research purposes for scientists to better understand the best window of time to intervene to help treat patients. Overall, this will allow researchers to better understand the time course of Alzheimer's. However, PrecivityAD only results in a probability score that reflects the likelihood of an amyloid-positive brain scan and is calculated using the person's age as a factor. For this reason, Procivity is meant for 60 to 91-year-olds with early signs of cognitive impairment that is used to enhance the accuracy of a clinical diagnosis. PrecivityAD is supposed to be used in collaboration in a clinical diagnosis to distinguish Alzheimer's dementia from memory loss due to other conditions. Overall, Alzheimer's blood tests provide a more accessible version that could, in the future, help to show who is at risk for Alzheimer's. Though these blood tests are not currently independent, they hold a lot of potential for future research and future diagnostic tools. I hope you will join me in further researching this amazing new innovation and all the new possibilities this blood test holds. As always, thank you for listening.